we've had four residents start showing symptoms of the virus. And so in response to that, we have put those individuals into quarantine and isolation. But an unknown result of that that we couldn't have predicted, in hindsight was probably something we should have predicted, but we didn't, is the mental health issues that go along with being in isolation. And for those of us who have a home, who don't have a diagnosed mental health issue, being in our home isolated, which we're all kind of doing right now as it is with stay-at-home directive, we can muscle through. But for someone who is on the brink of a mental health break or suffering with severe mental health issues, putting them in isolation is very, very difficult. And so with those four individuals, one of who has moved to the motel, so he's out of the shelter. But for those three other individuals, they have had a very, very hard time with that. One woman, all three of them have left because they couldn't handle being isolated. We need people, we need community, we need support, we need interaction. And being in isolation, even though you're in a shelter, that's not possible.
Yeah.
So what I've started to do two things. The first thing is working closely with Mercy Hospital, Allina Health System, and they've been amazing. Thank you, Allina Health, for your help, and getting those individuals who show symptoms tested as soon as possible. We are, our residents and our staff are considered one of the priority groups for testing. And so now when an individual shows signs of symptoms, we will get them tested as soon as possible. But the other issue that comes with that is transportation to get them tested. And so coming up with creative ideas on providing transportation for that potentially sick individual to get tested has been a hurdle. So working on that. But there's still days, between when the symptom shows up, when we're aware of the symptom, when transportation is resolved and figured out, and when test results come in. And so there are days that those individuals will still need to stay in isolation, that they need some support. They need some mental health services. And so now working with Anoka County and our other mental health service providers and getting them the real help that they need during this time also has to be a priority.